Okay, so now we can start with the first lecture, that is health particularities in disasters. You should be able to see my screen. Okay, good. And now we are going to have a quick overview of the impact of different disasters on health. It's a very wide, a very complex topic because especially in disasters, in general in medicine, but especially in disasters, there is not a linear relationship between the event, the earthquake, the flood, the heat wave, and the effect. There are different paths, different factors that we need to take in consideration, and also we need to focus not only on the immediate effects, but also on the long-term ones. So we are going to see the relationship between disasters and health. Remember, health, we are not talking only about disease, but about health in general. We are going to discuss about the affected population and the effects under a short and a long-term overview. Then, of course, we need to focus, to bring some examples in different disasters, like flood, earthquake, landslide, and mass gatherings. First of all, remember that each disaster is different from the others. Each disaster has one or more triggers, and based on the characteristic of the trigger or on the characteristic of the event, we are going to have a different impact on the health. As you can see, for example, the number of and the proportion of affected and dead people in different disasters is extremely heterogeneous. For example, as you can see, landslide caused a lot, of course, in proportion on the number of events, a lot of death, but no affected. And we need to take in consideration this. With other disasters, for example, floods cause a lot of death, but also a lot of affected. You can take the number on the second row, that is the average number in the last 20 years, and you can see, like at a glance, you can see that we need to have a different approach responding to a flood rather than responding, for example, to a landslide, not only in terms of the specific cares, the specific devices, the specific resources, but also in mentality. In landslide, we don't have, in general, to apply important cares in the immediate aftermath after the event, different from the flood. So this is why it's important to understand the characteristic of each type of event and of each type of disaster. And as I already mentioned, we need to take in consideration not only what we see just after the event, but also we need to look to the whole timeline. We have during time different needings. We need to use different approaches based not only on the disaster as we saw, but also based on the population, the vulnerabilities, and the resilience of the specific community. As you can imagine, the same event, for example, an earthquake, can have a different impact on a resilient and on a non-resilient community. So knowing in advance what are the vulnerabilities, what are the needs, what are the specific issue in each community and for each disaster is important, also to forecast in some way the effect on health of disasters. And remember also this, that health is a state of complete physical, mental, and social well-being, and not only the absence of disease or of infirmity. And this is very important because the classical stereotype about disaster medicine is that, okay, there is an earthquake, I go, I do things, I go, I treat people, I go, I do surgery on traumas. Okay, this is good, but this is only a small part of the whole approach to protect health. And also under this view, when we need to evaluate especially the long-term effect of disasters on health, we have to take in consideration the whole system. Health impact is only a small part of all the effect of a disaster on a community. There are also, of course, social, economic, environmental impact. But these layers are not unlinked between each other. There is a strong link. So when we plan the health response to disasters, we need to take in consideration also the economic impact. For example, diabetic people, people with chronic illness, will they have money to face the new condition? For example, to buy drugs, to pay for visits, to pay for healthy food, all of them are important things to take in consideration, as well as socio-demographic factors like age, sex, social status. Knowing all these parameters is fundamental to forecast, to imagine the pattern of the impact of disasters on health. So in the table on the right, you can see an overview of the health impact that is direct, for example, on the population health, injuries, death, an increased risk of communicable diseases or acute illnesses like intoxication, poisoning, but also an increased morbidity and mortality in chronic diseases due to the lack of chronic treatment of drugs taken in chronic illnesses. But we are going to have also indirect effect on the population health. For example, an impaired access to health services, for example, a earthquake that interrupts a road, and loss of normal living condition. In addition, on this direct and indirect effect on the population health, we are going to have also an impact of healthcare system with the interruption or at least damaging of the normal services for people. Clinics cannot work at their maximum capacities. Health centers can be destroyed, or under a more global view, also the prevention programs and the prevention initiative can be interrupted. I mean, after a disaster, it's normal that, for example, sexual transmitted disease prevention programs are suspended or interrupted, but people continue, of course, to have sexual habits. So we are going to see an increase in sexual transmitted disease, for example. And now we are going to see only the short-term effect, but it has been demonstrated that there is like an effect also on the long term in a span of years. So we have direct casualties like people with physical injuries, people suffering from post-traumatic stress disease, and due to lack of chronic disease management. You have a disaster, we have a link between the disaster and the defect, and this affects the direct casualties. But we are going to have also indirect casualties with PTSD, for example, people not directly exposed to the disaster, but maybe looking at the images looking at the newspapers that suffer from, of course, limited but important PTSD. Similarly, if I have a disaster in a specific region of my country, for example, of Italy, it can affect indirectly the whole country. For example, with economic losses, social losses, and the disruption of the entire health services, despite it has not been directly affected by the disasters. Also, never forget that also rescuers are under a view victims for physical injuries during rescue, but also for post-traumatic stress disease. So, as you can see, unfortunately, the image on the right is in a low resolution. Honestly, I don't know why, but I will share it to you in the full HD resolution. I would like to propose you something that you could have already saw. That is the UN clusters for response in disasters. This is very important, not only because it represents the different fields of intervention, of humanitarian and emergency relief, but also because you need to take in consideration all these aspects when you think about health. For example, nutrition can directly affect health. If I don't have healthy food, people go to take unhealthy or trash food like hamburgers or snacks, and these in large numbers can affect health. Similarly to water, sanitation, and hygiene, but also education, that is maybe the most important base on which build healthy habits. On the right, the image represents the impact of COVID-19 on different aspects of life. And as you can see, health is represented here, but is only a small part, of course, interconnected, of the whole system. This introduction, under a specific view, maybe is too general, but is like this to show you that it's difficult to talk about health in disasters, because now we are going to talk about specific diseases and specific conditions. But remember, when you work into a disaster setting, that you have to take in consideration the whole event and not only the specific disease. This putting in context what you say within the larger framework of the disaster is fundamental to correctly approach the events and correctly set a response. But now we were a bit theoretical and general. Now better to go more in details. So I would like to show you different effects on health of different disasters. A disclaimer is that, of course, each disaster is different from the others in terms of intensity, size, population affected, response. So these are general concepts that need to be adapted to the specific situation. First of all, we talk about flood. And this is the classical example of immediate, mid-term, and long-term effects. The immediate effects are very simple to understand. Traumas, for example, due to collapsed buildings, car crash, or other collapses, electrical injuries, burns, and eventually, but less common, explosions. Other immediate impacts are the hypothermia due to the cold water, and despite less frequent, the animal bites. Remember that you don't need a very cold water to have hypothermia. You only need water some degrees colder than the body. We have also mid-term effect, for example, infection due to diseases transmitted within water, both eye and oral fecal infections, but also poisoning, for example, when some chemical fluids leaks in the water, and shock mental health. But more interesting, we are going to see also long-term effects. For example, a disruption in the effective healthcare system with an increase of mortality and morbidity due to chronic and diseases not caused directly by the disasters. This is very important and in general, it affects all the type of disasters. It has been demonstrated that after floods and storms, we had an exacerbation of chronic illnesses like diabetes and cardiovascular disease. So if at the beginning it seems not so logical to think about diabetes, I mean water foods do not contain sugar or other principles, but in general, we need to take in consideration also this impact on health. Of course, for this impact, we need a deep understanding of the place of the services already deployed on in the affected country, in the affected region. We need to know the population. We need to know the most common chronic illnesses, and we need to design to develop a system to face also the long-term effects that are less easy to understand, but common and transversal in all disasters. Similar to floods are earthquakes, in terms, of course, of long-term impact. In the short-term time span, we need to take in consideration some particularities. For example, the first peak of demand is generally between 12 hours and 3 days after the event. So if we are working in a seismic environment, when it's likely to be an earthquake, we need to take in consideration that we need a very quick response, quicker than in other events. The most affected peoples are the very young and elderly and individuals with pre-existing physical disabilities. Why? Because they are slower in evacuating the buildings. Imagine a 90 years old person. Of course, he or she is lower than a younger one, and is more likely to be affected by building collapse or other traumas. So the main short-term disease we are going to face are orthopedic and soft tissue traumas. We need also, of course, take in consideration the weather, because the same event, the same earthquake in the same city can have a different impact on health if we have a sunny day or if it rains or snowing, of course. And also in the short term, we can see some exacerbation of chronic illnesses if not managed properly, in general due to the lack of some administration of drugs. The most common physical injuries are, of course, limb and multiple traumas, with a specific condition that we are going to see in detail, that is the crash syndrome. That's not so common in other settings than disasters, and we need to know the basics of its treatment. Similarly, and linked to the crash syndrome, we have the dehydration-induced acute kidney injury. Also, we have neurologic injuries and internal damages. As you can see, the mortality is higher in the first hours after the event and at the end. So in general, we need a very quick response, quick in identifying, in evacuating and in treating the most common injuries that you can see on the table on the right, fractures, soft tissue, in particular affecting the extremities due to building collapse. As you can see, the curve on the graph on the left show you that the population at a higher risk of mortality are the children below 5 years, because their evacuation is difficult, and of course they are more delicate than adults. Similarly to other intervention in disasters, we need specific protocols. In particular, we need to focus more on one medication and on stop bleeding, so to treat the most urgent condition, maybe using different scales to evaluate quickly, similarly to what is done by disaster triage, what to do for each patient. Of course, this evaluation follows the triage, so we are in a phase, in a more advanced phase than the triage. So I would like to focus a bit more on the crash syndrome, that is particular because it's common, and we can see it only in people trapped for a long period of time under debris or under something. How it works? It's very simple. Muscles are damaged due to the trauma, due to the collapse of the building, due to the trap under an object. They are damaged and they release myoglobin into circulation that goes, of course, to the kidneys, and in fact, myoglobin occludes the structures of the kidneys, the nephrons, and all the microscopic structures, leading to the necrosis or to the acute renal failure. In the right, you see, I'm not a physiologist, but a more detailed schema. So we have a prolonged pressure on the limbs. We have ischemia that damage the muscles, but we have also a direct insult on the muscles. This leads to ischemia, damaging the tissue. When I reperfuse the muscle, in general, when I untrap the person from the debris, I have the rhabdomyolysis, I have the compartmental syndrome, and I have the release of the myoglobin within the circulation. All together conduct to the crash syndrome that in fact lead to the acute renal failure. So you can imagine that if we are planning before, of course, the response to disasters, including that includes traumatic events, we need to take in consideration the possibility of a peak of acute renal failures, and we need to buy and to prepare some different dialysis machines to face, of course, this condition. We also need to train rescuers to face this specific condition. For example, administering fluids, physiologic fluids, before the extrication from the debris. Different studies assessed also the medium and long-term effects of the earthquakes, and it has been demonstrated that some pathologies, for example, the death for coronary heart diseases, but also some particular diseases like gastric ulcers, were increased after years from the earthquake. That demonstrate that we need to deeply understand the impact of these events on the population on the long term. As you can see, it's not so immediate to understand why, but the increase of incidence of gastric ulcer was demonstrated, as well as the death for coronary heart disease. So also increasing the studies, increasing the research on this aspect is fundamental to design and to implement an appropriate response. Similarly, earthquakes, but in general, all the disaster has a similar impact on the people behavior. For example, the sedentary behavior after an earthquake increased, and as you know, the sedentary behavior leads to an increased risk for some chronic condition. So it's like everything connected, and we need to take in consideration all the aspects to deeply understand the real effects on health. Similarly, before we were with the study in Italy in the L'Aquila earthquake about 12 years ago. This one is from the Great East Japan earthquake. They saw similar effect on the long term. As you can see, the curve continued to raise after 6 years, demonstrating that we don't need only a quick response, but we need to implement a long-term response, or better, a permanent change and a permanent improvement in the health system. This slide was supposed to be before. I don't know why, maybe problem with the PowerPoint file, but is another schema showing you the effect of the crash syndrome from the rhabdomyolysis to the dehydration, with all the intermediate events that at the end conduct to acute renal failure, leading to hyperkalemia, hyperphosphatemia, and also other specific metabolic conditions. The prevention and the treatment of the crash syndrome is very simple. I mean, you need in particular only to administer IV fluids before extrication, but if not included in the response plan and in the training to the professional, it can lead to an increased mortality and morbidity. Similarly, from some point of view to earthquakes and the landslides, that in general are usually triggered not only by a natural risk, but in general by a combination of natural and technological risks. They cause a lot of death, and the typical pattern of this type of disaster is a huge number of victims, death victims, and a small number of injuries. However, traumas and injuries are very similar to the earthquakes one, including trauma injuries, asphyxia, and hypothermia. Differently from a earthquake, the big difference is that if in a earthquake we have both huge number of death and huge number of injuries, here with similar injury pattern, we are going to have in general a smaller number of injured people. And then we have the mass scattering events that are events with a lot of casualties, a lot of involved people, are events in which a huge number of people are crowded in a confined space, causing a delay in the emergency response. That is caused by the limited access, for example, limited ways, traffic jam, other things that obstacle the access to the scene, but also the event type, the victims, the number of victims and their behavior, but also environmental factors. What are the main health impact of the mass gatherings? The majority of them includes minor injuries like respiratory diseases, headache, sunburns, mild medical condition, or asthma attacks. We can also see, for example, in concert or in other public events, abuse of alcohol, of drugs, and this is routinary. The big problem is that the huge number of people confined in a small and defined space can lead to something bigger than these minor injuries. An example is the disaster of the Love Parade. That was a festival in Germany, performed on July 2010. It was a free music festival within an old railroad depot. So in a confined space, they estimated an official capacity, a certain official capacity, but the real attendance was more 4 times the real official capacity. So there was a huge overcrowding of people, with another big issue that the access was permitted through the tunnel that you can see in the image. So the guests started entering the festival through this very long tunnel. After some hours, there was overcrowding, and police closes the tunnel entrance from one side. But guests continues to enter in the tunnel from the other side, causing an overcrowding of people and leading to a massive panic attack. Here you can see the global view. You see both tunnel. In a certain moment, a stair collapsed, but without causing damages or injuring people, but it caused a lot of panic. People overcrowded the 16 meters wide tunnel. Some of them fell down, and death by crash, of course, from other people that run on them to escape. So as you can see, the same event can lead to 2 completely different scenarios. The first one, small injuries, respiratory diseases, minor injuries, health strains, mild condition, but we need to plan and to prepare for the worst case scenario, that in this case is the stampede. As I tried to show you, the understanding of health effects of disasters is very complicated. It's very difficult, with the problem that if, for example, for cardiovascular diseases, we can perform studies on millions, in fact, of people, we have luckily only a small number of disasters that we can assess and that we can study to deeply understand the effect. So it's important to take in consideration all the aspects, all the features, to try to understand and to forecast the effect of disaster on the health. In this last image, I would like to show you the effect of 2 scenarios. You can see what happens if the distribution of insecticide, nets, and other tools to prevent malaria fall down by 75%. You can see the huge increase in cases and of death. And you don't need something so big to cause this lack of insecticide distribution. You only need a disaster. You only need COVID-19. You know that COVID-19 in Africa caused a lot of death through indirect effects, not because COVID caused respiratory problems to the African people, but because COVID blocked, interrupted the prevention and intervention programs of NGOs in Africa that led to the disruption of the distribution of different things, from malaria control tools to other strategies to protect health. So it's very difficult to discuss about disaster. There is no a direct link between a disaster and what I have exactly to do to face the effect. I can't say I have a earthquake, I need to do this, and this one. But I have to take in consideration all the aspects and to plan and to prepare my response for both the immediate and short-term effect, but also for the long-term effects that are likely to affect the community for years. So this first presentation on the health effect is at the end. If you have some question about the slides, I'm glad to answer. Okay, if there are no questions, I would like to propose you 15 minutes of break, and then we will be back for the CBRN lecture that will be more specific, of course, because it's not specific, it's on a specific topic, and for the exercise on the CBRN response. Okay.
Okay.
So we will be back at 15 minutes after 4, okay? Be on time, so we can start and finish maybe earlier than the schedule.
Okay.
Thank you, see you later.